Trendelenburg position. So whenever we give Trendelenburg, all our abdomen, the bowel goes cranially. So we have placed then all our lateral port. So we can see numbering 1, 2, 3 and 4. So 4 arms are there. So consecutively we have done. This is the second arm. By default, any arm can be a camera mode, but by default, central arm we place at camera mode. So this is the camera. Then the one lateral port. It's 4 or 5 fingers width, around 8 to 9 centimeters lateral and caudal to the. So this port is around upper border of the umbilicus. Lateral 4 finger lateral to the camera port. Similarly on the right side also we have a. So this current constitutes to the third port. One port is extremely lateral. This will be our fourth correspond with the fourth arm of the robot. And we have 2 assistant ports that are placed 4 fingers caudal, cranial and lateral in between the first and second arm, and one is extreme lateral. So this is our configuration, fan shape, and our target organ is prostate. So this is around 45 to 50 degrees of Trendelenburg. So whenever we put our camera, we can see the nice anatomy of the pelvis, prostate, the iliac vessels, lymph node dissection, whatever our pelvic dissection area is there. Now coming to the robot, this is a X system. So we have, as we see, 1, 2, 3, 4 arms. And first I will talk about this draping system. This is a particular drape for the system, and it is compatible with X and XI system. It has first the locking mechanism. So it has folds which corresponds to the folds of the arm. So we drape it like that, and there is a red button here. So we can fix this to this. Now it is a magnet which fixes the drape. Now here we can see 3 plastic things like this. Here is one button for the function, and another is this button. So by these 2 buttons we can manipulate the arm, and we have some attachings. This is the attaching over the first finger. This will go like this. Now this is attached. Second is this, wherever our instrument goes, we have 5 mounts over the 5 wheel type structures. These will correspond to the instrument here, and this structures it is also detachable, and whenever we fix it, all the wheels they rotate and it configurates all with the robot. Third one is for the port attachment. Here we can see there is a port attachment, and with this sound we can see it is perfectly draped. So by these 3 or 1/4, there are 4 attachments for the drape. Once it is perfectly aligned, now our port is ready for docking. Similarly, all the 4 we have different things. Then we ask Sanjay bhai, तुम कैमरा this and this clutch here. So we will push the clutch, make the both the things come together, and there is a notch here in the port. So we will engage the clutch and disengage all the notch in between them. That will
the operating table while DaVinci is dark.
And we can hear that sound. Now our first port is in. Similarly, all the 4 ports will go in. This is the arm 1. Third one, and then 4th. So all over 4 arms are. So then we will take camera. Now I will like to tell you about something. This is air seal. this is a new device. So what it does, earlier we have a routine whatever we are using in laparoscopy. So whenever we do suction, there is a significant drop in the intra-abdominal pressure, and while if we are in important step that drop would bleed or something else, the gap between the tissue reduces. So that was a constant problem. So what this company has met, there is a three tubings. One is for suction, one is for this infusion, and third one is for monitoring the pressure. So what it does, it has an intelligent monitoring system, flow system. So it automatically, whenever we are doing suction, it senses and it increases the flow. So it helps in 2-3 things, that whenever there's a excessive use of cautery, so there's a lot of smoke, and you will see today that during the DVC resection and during the posterior resection, there's a lot of smoke. So with this system, whenever the suction is activated, all the smoke goes away. And second benefit, the intra-abdominal pressure, there is we can see 14. So whatever we have kept, that will be maintained within a milliseconds. So the drop in the pressure is very less, and we can see a constant pressure all around the abdomen while the surgery.
This is part of X.
No, this is not the cast.
Separate.
Yes,
Separate.
yes.
And again, like reusable instrument, the cost is involved in that. So
Mm.
we give it only for special operation.
Yes.
Disposable is around 15,000 additional cost. Vivek also showed the specifications of the telescope.
Yes, sir. Light button. Yes. Now you can see. Okay. So whenever the system is on, we can see this green button, green light. So we have 3 buttons here. You can see like this. This is for activating the light. This is for, we have 2. If I put out the light, we can see there are 2 eyes. You can see. So this exactly matches the console. There are also 2 eyes. So this is the system that it acts as human, like the human eyes, and gives a 3D vision. So whenever one eye is smudges, we can change the this assistant screen with second eye. You can see. So both the eye can be changed. And third one is for screenshots. These are the 2 hooks which will go in, and all the 4 pulleys, they will attach with this camera port. Now it is ready to go. So what we have to push the button, and we have to push the instrument in. Now going in, we can see the intra-abdominal anatomy. By adjusting the camera port, now what we have to do, we have to lock it, and we have to move for other instrument. So what our other, primarily we will use 4 instruments. On right hand sides there will be a scissor, monopolar scissor with cautery. This is the monopolar curved scissor. So right hand will we have scissor, and we will attach this green cautery. This is the robotic cautery. So scissor with monopolar cautery is ready on the right arm. Then we, on the left arm, we have bipolar. It is a
Progress.
so this is the, it is a straight just Maryland configuration, but in a straight form. So it contains fenestrated bipolar forceps, and we will attach a bipolar cautery with it. So this is the bipolar cautery. We will attach it here. We will fix it here. Progress. It has a fixed, means it is not that powerful to damage, but it is that powerful enough to hold the tissues. So it will go in 4, and it is non-energized. So it is. So now installing all the 3 instruments, what we will do, there are, after activating my camera, we can see 1, 2, 3, 4. all the instruments are seen, but they are out of the vision right now. So the monitoring system is indicating that your instrument, if you will push, will come through this direction. If I will move my third arm, it will also move on the like this. You can see. So I want to push the third arm. It will come from exact area where it is showing the third arm. So I am going up, that is going up. Now you can see exact area. So this intelligence system protects from inadvertently damaging any bowel with the sharp instrument. Now fourth, we can see it is out of the system, and we will push it up. So it will also. हाँ सर मैं अभी वर्क करूँगा. Yes sir. Now हाँ. Similarly on the left side.
You are pushing the entire arm to push that.
No. You can see I am just pushing this
Okay, that's the lower one.
mount.
Mount.
In time now I will do, but you can see the by positioning our ports are skewed, so we will do burp. So all the tension over the port will go away. In all the four levels.
But that time
That will go after once I fix the instrument. Now it's known as 3-port view. We can see all the important all the instruments, they are in the vision. Our target anatomy is in the vision, and now I will ask sir to start.
so this is seen by the console.